I wanted to turn to access to termination of pregnancy services, particularly in public hospitals. The Secretary is nodding because she knew I was going to ask these questions. The Premier is on the record in question time last year saying that the public hospital network has a role to play, this will be fully funded and the services will be available. I think last time I asked the Secretary about this was December last year, talking about sort of doing a mapping exercise, a networking exercise, a stock take exercise. What are the results of that, and will the services be available in public hospitals?
Yeah, so can I acknowledge the incredible advocacy both from members of Parliament like yourself as well as the broader community in relation to this. We've allocated, I'll stand corrected again, but around $6.3 million for abortion services across New South Wales. We are doing a number of things: A, mapping the pathways; B, making sure that disadvantaged women have access to funding to carry these out. I think we've got around 40 odd sites across New South Wales where this can now take place. As you would know probably better than anyone on this committee, Chair, medical and surgical abortions can be provided in community, non-hospital settings and private providers, etc. And we are also continuing with the Pregnancy Choices hotline. But Elizabeth, did I miss anything in relation to that?
I can provide some further detail if you'd like it. Yes. So we've addressed this from a number of elements. So firstly, we've really put a focus on increasing access to contraception services, particularly through the long-acting reversible contraception approach. But I think if we refer specifically to New South Wales public facilities, there are 40 facilities providing a mix of medical and surgical termination services. If that service does not provide that particular service, then referral pathways must be in place to ensure women have timely access to care. We're updating all of our policy documents in line with the legislative amendments to the Act, which is seeing an increase now obviously in nurse practitioners and endorsed midwives able to perform this procedure. But we also do recognise that women need information and access to information to make informed choices about where they undergo their services. So what we have done is we've really increased the investment in Search Plus, which and Search to really support women to find access to the information that they need about services in a really timely fashion, because we do recognise that as soon as they can have that information, they can make informed decisions, and we really want to support them to be able to do that.
And Chair, you'd be aware, I think, that a review of our policy documents in relation to terminations of pregnancy is underway. That's important, and we will have that completed by end of this year. So I just wanted to make sure the committee had that extra bit of information if they didn't have already. But that is, what is that designed to do? That's designed to provide what I would describe as clear guidance on the roles and responsibilities for New South Wales health staff in relation to referral care, follow-up care, etc. So that's us having a look at what we have in place, given some of the reforms that people like yourself and others have advocated for, to make sure that our delivery of that is reflective of those changes in legislation, and that has to be done.
Thank you. I have a couple of follow-up questions. So the first one is relating to the change in legislation, and I appreciate that you supported that change, Minister. For nurse practitioners or any endorsed midwives or employees of New South Wales Health, if they're practising within a New South Wales facility where abortion is within the scope of services provided, are they now able to prescribe as per the changes to the Abortion Law Reform Act, or are there further changes that need to be made?
Yeah, I'll go through a few things in relation to this. We're reviewing our training and education models that will support the nurse practitioners and endorsed midwives to provide those termination of pregnancy across New South Wales. We're also progressing work to enable, this is important change, enable endorsed midwives to utilise their endorsement in New South Wales public health facilities. Endorsed midwives are currently, as you would know, Chair, sorry, but others may not, are not currently employed in New South Wales Health, There are around 221 endorsed midwives working across New South Wales, but that's outside our system. But since updating the termination of pregnancy notification form on 1 July 2025, New South Wales Health has been notified of nurse practitioners and endorsed midwives who have provided early medical abortion services in the community. The notifications received to date have come from both private providers and non-government organisations, not New South Wales Health.
I wanted to follow up some of my questions this morning about abortion services. The first one was Ms Pearce, you indicated that there had been no notifications yet from within New South Wales Health, and I just wanted to follow up on the detail of the ability of employees, if they're now enabled by legislation to prescribe. Is there some kind of policy or other barrier preventing, for example, a nurse practitioner employed by New South Wales Health from prescribing the MS two-step medication? Does this require your policy review to take place, or is it just that no one's? Is it just a coincidence that no one's prescribed yet?
I think, look, thank you for the question, Chair. Because we're at the start of actually delivering this report each year, the information that's in the report is from prior to the legislation changes. There is no blocking in terms of reason for them not to have been reported. At the moment, we just don't have any endorsed midwives within New South Wales Health, but we are working very closely with our Nursing and Midwifery Office as we review the policy directive changes to really articulate the role and function that we see and how they could be engaged meaningfully. But we are seeing, in terms of the early indications that are coming through in line with the new reporting of the notification system, we are seeing notifications from nurse practitioners and endorsed midwives across New South Wales.
Okay, thank you. So I understand there's some things to work through in terms of the role of endorsed midwives, particularly in birthing and other areas, which is not what I'm asking about. So hypothetically, if there were an endorsed midwife engaged at a New South Wales Health service, there should be no barrier to them being able to prescribe if that were within the scope of the service.
As long as they were able to meet demonstrate that they met the requirements of the endorsed midwife position, no.
Okay, thank you. And I also wanted to follow up, you mentioned 40 sites providing medical or surgical abortion.
That's correct.
Around the state. Is that public, or does that include partnership agreements?
No, those are 40 public services, and they operate a mix of medical and surgical terminations. In the report we have most recently put together, 89% are actually, in terms of the earliest stage of abortion, very much provided outside of New South Wales Health. But of the 40 sites that we do have, it's very clear for those who do not fit into those 40 sites what the referral pathways are to access those sites.
Is that list of 40 sites publicly available?
It's a mix of availability, but what we have done is, in terms of the Search Plus work that we've done to really support women to actually connect in so that they can be connected to the service options available. What's important, I think, to remember is that it's giving them the whole gamut of information so that they can make the choice as to where they might want to access services. But we have been working very closely with all of our providers to make sure that we are clear in terms of those referral pathways, particularly in rural and regional areas where there's obviously less service provision in terms of compared to metropolitan areas, to make sure that our services are complementary and connecting together so that women have got a full choice of service availability options to them. But again, I think what is pleasing to see is an increase in women accessing those services earlier on, which I think is, in terms of their experience and certainly the process around it, is a good thing from our perspective.